another episode of the 2020 podcast, Canada's #1 optometry podcast. I am your host, Dr. Harbir Sayan. Thank you so much, as always, guys, for taking your time to join me here to learn and to grow. I'm so excited. Happy New Year. Welcome to the year 2025. I hope your year is off to an amazing start so far. I'm very excited to bring you some brand new, amazing content, hopefully impactful content, something that's going to maybe push the needle a little bit as far as making a difference in our profession. As you know, this is the goal of the podcast, is really to try to elevate the profession, to help our colleagues to grow, the profession, the industry to grow, to make some changes in the right direction. And this episode, today's episode and next week's episode, are definitely two of those types of episodes, two of those types of conversations. I'm doing a little bit of an intro here, but as I go into the actual interview, you'll hear me do a bit of an intro there as well. But this is the first of two episodes with four guests on the conversation of scope expansion in optometry, specifically in Canada, because as you may know already, most provinces in Canada are a little bit behind most of the states in the USA, but every province in Canada is a little bit different. And some provinces may be a little bit ahead of others as far as scope goes. And so these conversations are really, really important conversations to help us all understand, where is optometry right now? Where do we want it to go? And why do we want it to go there? Why do we want scope expansion? Why is that important? That's a huge question. And then who or what entities are opposing it? Who or what is providing the friction or the obstruction or the whatever other word you want to insert in there that's slowing the progress or preventing the scope expansion in optometry? And why are they opposing it? What are the reasons for it? So that is what you're going to hear about in the next couple of episodes. And I really encourage you, even if you're not Canadian, or if you are Canadian and you don't care so much about scope expansion, there's a lot of other really, really important information in these conversations that's so valuable for us to all know. So we are thinking about our profession the right way. We're always thinking about how we're going to elevate and grow the profession of optometry. Because if we don't, if we become complacent, if we become lazy, if we become uninterested, that ultimately is going to lead to the future demise of optometry. It's not that we're going to stay status quo. If we're not constantly pushing forward, we are ultimately, the profession is not only not going to grow, it's likely going to shrink and shrivel and not be what we want it to be in the future, whether it's for our own sake or whether it's for the future generations of optometrists. So there's a lot of that very important conversation going to happen in the next two episodes. The first of these two episodes, the one you're going to hear today, is with two amazing guests, Dr. Shaina Nensi, who is the president of the Ontario Association of Optometrists, and Dr. Sophia Leung, who is the president of the Alberta Association of Optometrists. And Dr. Leung brings not only her understanding as the president of the association, but also having being residency trained in the US, practicing to the fullest scope, whether that's using lasers or doing minor surgical procedures, and really bringing that knowledge and that experience to this conversation as well. The second episode that you're going to hear next week, again, is with two amazing different guests, Dr. Evelyn Lo, who is the president of the BC Doctors of Optometry, and Dr. Sarah MacIver, who is the director of the educational program at the University of Waterloo School of Optometry. So she really is not only trained to the fullest scope, but she's the one who's training students right now, to the fullest scope. So the students coming out of Waterloo are trained and ready to provide the services at this expanded scope, at this expanded level of scope. So really interesting to hear from her as this subject matter expert on the topic. And of course, Dr. Evelyn Lo, our president here in BC, from her position overseeing our association. So really amazing conversations. Of course, they've already been recorded, so I can tell you from my experience, I'm very, very excited to share these conversations with you. I also will tell you, I do get a little warmed up in some of these. As you know already, I tend to step up on my soapbox and share my opinions throughout the podcast. And I didn't hesitate to do that over the next couple of conversations. I think sometimes it's a little necessary to kind of poke and prod a little bit. So if you find that something I said didn't quite sit well with you, that's okay. I want to really stimulate this conversation. Feel free to reach out to me and let me know if there was something that really did resonate with you, or perhaps something that you didn't love that you heard on this that maybe will help push a better conversation forward. So make sure you reach out to me, whether it's on Instagram at harbirsayan.od, or leave comments on YouTube or wherever you can find me. It's not that hard to find me on LinkedIn, wherever it is. I'd love to hear hear your thoughts. And I'd love for us to have more of this type of conversation. So please do make sure you share this put up a link on LinkedIn, send it to your friend via text, or put a screenshot on Instagram. However you can share it, please share it. We want to let as many of our colleagues know that we're having these really, really important conversations that are going to help to grow our profession. That is the ultimate goal here. So without further ado, this is the first of these two important conversations on scope expansion. I hope you love them. Let me know what you think. Hello, and welcome back to another episode of the 2020 podcast, Canada's #1 optometry podcast. I am your host, Dr. Harbir Sayan. Thank you so much for taking the time to join me here, guys, to learn and to grow. As always, so grateful for all the support, all the sharing, the liking, the commenting, all of that kind of stuff. Helps the podcast to continue to grow and keeps me energized to keep doing this as well. So thank you so much. And as always, I have a big request right off the top, which is if you do get some value, please do share it. Whether it's sending a link or posting it on LinkedIn or, tagging us on Instagram, whatever it might be. If you see a clip of it somewhere, please share it, send it to a friend. This is going to be a very, very important conversation, especially for Canadian ODs. Now, if you're in the US, please don't tune out because I think there's going to be still some very important things in here for you. But for us Canadian ODs, if you recall, you may recall, if you listen to the podcast for a while, a couple of years ago, I'd started a series that I called The Future of Canadian Optometry. And the goal of that series was to bring on leaders throughout the profession, throughout the industry, to ask them hopefully tough questions and see where the profession's going and how we can help to continue to grow the profession in the long term, to help it thrive. And we're sort of rejuvenating that series in a way to talk about scope expansion and the importance of scope expansion for optometry in Canada. So we're going to do a couple of two-part series here. The first one here today with our wonderful guest, Dr. Shaina Nensi, who is the president of the Ontario Association of Optometrists, and Dr. Sophia Leung, who is the president of the Alberta Association of Optometrists. And we're going to do a second part with a couple more special guests, so make sure you stay tuned for that one as well. There's going to be a lot to learn here for all of us ODs in Canada as to what is the point of scope expansion? Why is it important? How do we go about it? Where is the resistance coming from? And why are we not expanding to the same level or perhaps the furthest level that optometry should be? So we're going to start that conversation today. So once again, my lovely guests are Dr. Shaina Nensi, who is the president of the OAO, and Dr. Sophia Leung, who's not only the president of the Alberta Association, but also what I would certainly consider a subject matter expert. Dr. Leung has done her residency and fellowship in Oklahoma, and if anybody's familiar, Oklahoma is definitely practicing to the greatest scope, if we know, lasers and all of that. And Dr. Leung herself has done thousands of procedures, including YAG, LPI, chalazion removal, and others. So we're going to talk to her a lot about that and what the benefits of practicing at that scope, that level is. So first off, I want to say a big thank you to Sophia and Shaina for being here. Thank you so much for taking the time. You're both obviously so very busy, being presidents and all the other things. I'm going to pass it over to Shaina first and let you kind of introduce yourself and tell us a little bit about who you are.
Hi, thank you so much, Dr. Sayan, for having me on the podcast. I am Dr. Shaina Nensi. I'm the current president of the Ontario Association of Optometrists, like you mentioned, and I'm so excited to be doing this podcast. It's so timely because Ontario really is in the thick of our most recent push for scope expansion. So, later on, if given the opportunity, of course, I'll run through what it is exactly that we're asking for, but it's such a timely time to do this podcast so we can get the message out there and really hopefully drum up more support for our current push for scope.
Absolutely. I think it's quite a key time for a few provinces, but it's nice to hear that Ontario is making that push. And as you said, we'll learn exactly what that means in a few minutes. Dr. Leung, why don't you tell us a little bit about yourself?
Yeah, thanks to you both for kind of, being able to have this conversation. The president of Alberta Association, I stepped in, that was in October. Alberta Association of Optometrists, we're kind of in Alberta, it's a little bit different. We provide kind of the collaborative role. The Alberta College of Optometrists has submitted our scope expansion request since 2020. And so it's been in front of government and with stakeholder discussions and all of that. It's been an ongoing thing for a little while now. So we are, still optimistic for, signs of change and movement towards it. But the discussion we're going to have, I think, is really exciting. I've also had the chance to teach some of this stuff, to teach this within certain advanced school courses, working with the University of Waterloo, as well as the American Academy of Optometry at SECO as well. And it's really quite fascinating to be able to chat with doctors really across Canada, across the US, to talk about exactly what we're going to be talking about, some of the barriers, some of the misconceptions about it. And, for states and jurisdictions that have it and those that hope to have it, it's been fascinating to hear kind of some of the thoughts, the hopes, the dreams, the fears, all of that. So I'm really excited for this conversation.
Absolutely. Super excited. Anytime I get a chance I love the podcast. I love doing this. It's one of my absolute favorite things. I'm so grateful that I've had the opportunity to create this platform. When I started it, it was a bit selfish. Like I wanted to create my own presence in the industry and start to kind of get out there. But over the years, it's thankfully turned into a platform that we can use for kind of the greater good of the profession. And so anytime we get to have these types of impactful conversations, it's really, really meaningful to me. I like how you kind of said the hopes and dreams and fears and all of that, because I feel like all of that sort of encapsulates that sort of scope expansion conversation. There are people who are excited and hopeful and people who are scared and unsure. And, what we want to try to do is help to answer a lot of those questions and give people a reassurance of, that we're heading in the right direction. So why don't I pose the first question to both of you, and I'll just ask whoever wants to take it. This is probably, maybe one that one person can answer if the other person wants to just add on. But first, let's start really basic, simple. What do we mean by scope when we talk about scope and then scope expansion? Just to put that definition out there, so everybody's on the same page.
Sure, I can start, and then Sophia, you can jump in if you'd like. So in optometry, there are regulated acts, which essentially means that an optometrist can't just go rogue and do whatever they want, whenever they want in their practices. There are certain rules, there are certain checks and balances in place to make sure that you are only performing acts that you are trained for and that you are allowed to do under your scope. And so what we're talking about when we're talking about scope expansion is really changing the legislation to allow us to do extra and additional procedures and testing and things of that nature in our clinics on a daily basis. So for example, within our scope is prescribing TPAs, and not within our scope currently would be doing a YAG procedure like Dr. Leung had mentioned she was able to do. So we can't unfortunately just say, hey, we're educated, we're able to do this and start doing it in our practice. There does have to be legislative change that allows us to practice the additional scope that we're requesting.
And the interesting thing about scope is that, one could define it as this is kind of the identity of the profession, right? But there is a huge variability. You go from a state like Oklahoma to, recently, for example, we know that in Massachusetts, they just got, certain diagnostics and things like that. And so you see this variance in this, not unlike Canada as well, right? We, Alberta has had, TPAs and, diagnostics since 1996. And, there are these nuances of the range of scope. And so the interesting part is that scope can mean a lot of things. Right now, I think the discussion is a little bit focused towards disease management, lasers and minor procedures. But, we don't want to forget the fact that also scope involves things like myopia management, things like vision therapy. And so some of the hot topics of scopes right now is leaning towards ocular disease, but that's not actually just that. And so, for optometrists who might be sitting out there thinking, okay, right now the scope discussion is just all about disease management. There's actually such a need for the understanding that scope encompasses what optometry as a profession, like any other profession, is within your jurisdiction. And if there isn't, I guess, a growth outside of that in every area, then you get this profession in one location that is stagnant, while the identity of that profession somewhere else continues to change, continues to evolve. So now you have totally different definitions of what this profession actually is. So scope can mean a lot of things. But it's important to understand that we look at it as a broad level of what is our identity as a profession. Is kind of the way I like to picture it.
I like that. Actually, that's excellent. That's excellent. Thank you both for those. Are both important contributions to that one question. And to your point about the stagnant versus other places it may be growing, I think that's an important. We're going to ask the why later. Why the scope expansion? Why is it important? We're going to start to dive more into that exactly. So why don't we talk a little bit about we're going to focus on Ontario on this one, unless Dr. Leung, you want to chime in as well on Alberta's side, but sort of maybe a brief history of scope expansion in Ontario and, over the last 30 years or so, where it's been and what's been allowed and what's not allowed even today, because I think there's some surprising things that maybe some of our colleagues in other parts of the country might be surprised that in Ontario are not part of your scope still.
Sure. Yeah. So our last scope expansion was in 2011, and that is when Ontario optometrists were allowed to start prescribing. So when we got TPA rights, essentially. And that was quite a while ago. And it was also, we were the last province in Canada to get those TPA rights. So we are definitely past due for scope expansion in Ontario, because there is so much more that we are trained and educated to do. Before that, it was actually 1987. That was our, if we want to go back even further, that's when we were allowed to use diagnostics. And so those are really the only two times that there have been scope expansion in Ontario. And so, like I said, we are past due. And if you don't mind, I'll probably just run through the key areas that Ontario is really trying to push for scope, because like Sophia said, it does sound like we are varied across the country, because there are some things that Ontario optometrists cannot do that other optometrists can do. And that is certainly part of our current scope expansion effort. So I'll just run through briefly. There are sort of 9 key asks of our current scope expansion, and they fall into 3 broad categories. So I'll start with pharmaceutical disease management. What we're looking for here is open drug prescribing. And what that means is that we can prescribe any drug that is like any ophthalmic drug, essentially, that matches our level of education. And so currently, Ontario has a list of medications that we are allowed to prescribe, both topical and oral. And that list is from 2011. So there are new drugs like Xiidra, for example, on the market that we cannot prescribe.
Not that new.
Not that new, I know. As an Ontario optometrist, it feels new because it feels not something we can do. But you're absolutely right. It is not that new. And I think that just highlights how unfortunate it is that our patients are not able to get the best quality of care from us because of these archaic lists that we have. So that is our first ask.
If I can, sorry, Dr. Nensi, if I could just, sorry to interrupt you there before you dive in, but I know that was the first point. It's interesting. I was speaking with some ODs in preparation for our conversations, and it was funny speaking to somebody from Ontario. I guess it's not funny, but the comment was, in BC you have categories of lists of drugs that you can prescribe. In Ontario, we just have a list, and that really kind of put into perspective from, we got the whatever different categories of steroids and the antivirals and the antibiotics and all of this. And in Ontario, it's like one list, which obviously is not that long if it's not including some of the, like we said, not that new medications. So I just found that sort of a bit of a wake up call too for me, when I was like, wow, you guys are definitely due.
Yes. And feel free to interrupt me anytime. I could talk alone for hours. Probably.
It's okay. That's the best type of guest for a podcast, I'll tell you.
So that is one of the first asks that we had. The other is independent management of open angle glaucoma. So currently, for certain circumstances, we do have to co-manage with an ophthalmologist, but Ontario optometrists and optometrists across the country, we feel really are educated and able to provide that care independently. So that's another one of our asks. And then the last ask in that pharmaceutical category is the ability to dispense and sample drugs. And that's really just a patient care point. We want to be able to have a patient try a glaucoma medication. The glaucoma drug reps are more than willing to provide us with these samples. And especially in today's economy, if we can get them to sample a drug, make sure it works before they have to pay for it, either out of pocket or even through their insurance, that really is in the best interest of patients, we feel. So that's sort of our first umbrella of asks. And then the next is diagnostic testing. So for this one, there is a little bit of just catch up, and all of this feels like catch up. Like Sophia was saying, we have so much education and so much knowledge about a lot of these things, but Ontario optometrists actually can't use ultrasound. So that means that we can't do certain forms of pachymetry. And
Interesting.
so it sounds so strange when I say it out loud, because it does seem like something that is so in optometry's lane. But it is becoming sort of the standard of care, or I should say the gold standard for myopia management, to be able to measure axial length with ultrasound. And we cannot do that currently in Ontario. So that is one of our asks. The other is ordering lab tests, and the third would be ordering diagnostic imaging. So CBCs, CTs, MRIs. And the purpose of that is really just to try and reduce the duplication of services. Oftentimes right now, if we suspect that our patient needs a CT or an MRI, we have to refer to either an ophthalmologist or a family doctor. And oftentimes when you refer to family doctors, if the patient even has a family doctor, then sometimes they either don't understand our referral or feel that they would like to refer to ophthalmology to get a second opinion on what it is that we're saying. And that really, one, duplication of services, and two, reduces the timeliness that patients are allowed to, or able to, get care in. And we have a number of stories, unfortunately, from our members here in Ontario, where there have been there's been sight loss, essentially, from this pathway taking so much longer than it should. So that is our sort of second bucket of asks. And then the third is the minor surgical procedures. There is one on here that seems like it should be a no-brainer, and that is the removal around restrictions for our let me restart that. Let me try that again. Removal of the restrictions for our foreign body removal. Currently,
a lot of removals.
That's a lot of words. But currently in Ontario, we cannot remove any foreign bodies that are below the epithelium. And so we don't really want to.
Isn't that like pretty much all of them?
I don't know if how often you use an algae brush and say, "Oh, I'm going to stop right before epithelium."
Yeah, right.
Patient to ophthalmology. But exactly that. We don't want to have to think about, can I remove this rust ring because it is 2 microns deeper than it should be, kind of thing. It seems unreasonable to ask these patients or refer them to the emergency room or to an ophthalmologist to have a procedure done that we can easily do in our chairs, because we are very well educated and have been able to perform and practice these procedures in school for decades. So that's one of our asks. And then the other two asks under that bucket is the ability to perform laser therapies, SLT, YAGs. And the last one is perform minor procedures like chalazia drainage, lid tag removal, some of the other, more interesting, or I should say more sexy ones that probably made their way across the province and that Dr. Leung was talking about before. So that's just a very brief overview of what Ontario's ask is. But there are a combination of things that other optometrists across the country can already do, and of course others that are more common in the States. But we're really hoping we can get here to better serve our patients.
Absolutely.
And it just makes so much sense, right? Like, sorry to jump in there. I was kind of like, oh man, I'm sitting here cheering Ontario when I'm hearing that list, because it honestly just makes so much sense, right? When you think about, if you were to put yourself into the patient's shoes, right? You present it to somebody you trust already. This is your family optometrist that has seen you for multiple years, and they know your case. They've seen your kids and they see your family, and you know that they can do their work, right? And so the one thing is that just because it's not in the scope right now for Ontario does not mean that Ontario optometrists are not trained to do this. And so it's one of the biggest limitations right now within sort of our ability to practice to our highest level of training. Even something as simple, again, across the board, optometry schools teach this stuff already. As of 2025, anybody who's graduating in a class from any accredited optometry school will be fully trained to everything that Shaina was talking about. And so just because there's a rule of this is not within the scope of practice for that jurisdiction does not at all mean that this isn't within our competency, right? And I kind of wanted to bring up also maybe a little bit sort of commandeering this conversation here, Javier, but on this,
as I said, this is what makes a good podcast. Go ahead.
But the referral pathway between optometry and ophthalmology, one of the things that can sometimes get really easy to kind of focus on it is kind of almost this little back and forth, this tension. And I kind of want to just call it out in the open. We know that it's there. We know that politically it's there. But what happens is that actually we respect what ophthalmology has gone to school to specialize in. We actually need them to be busy, but we need them to be busy with the right things. And so if they're busy with the things that actually can be handled without the duplication of services that Shaina was talking about, it actually makes a lot of sense for healthcare systems to be able to adopt the ability for every healthcare professional to be able to do the highest of their training, because nobody wants people to be busy with all the wrong kind of cases, right? If there's an efficient model that can be done, then it just makes so much sense. So when I was hearing that, I was just kind of like, go Ontario, go, as I am, go Alberta, go. But yeah, it honestly makes so much sense.
That makes a lot of sense, and thank you for putting that out there. Actually, I think that's very important. It's better to sort of like call it as it is. We know that there's pressures and resistance and things and strain from different directions, but and there's definitely no argument that ophthalmologists are trained to the level they're trained at to do the things that they are trained to do, but to avoid the overlap, to avoid the duplication, and to avoid the inefficiencies, I think there's a lot of benefits to expanding the scope, and which is, we're going to get into that in a moment, like why it's beneficial. But the list that Shaina gave, the list that you gave, it might sound like a long list to some, but if we go back to what you're saying, some of the things in that list are just getting you up to speed, just to catch up to the speed of like the level of other provinces that have been practicing at that level for years and years, and including, for example, being able to prescribe Xiidra, like just a simple example, right? So there's that, which is a good chunk of the list actually that you gave, and then there's the list of like, okay, here's the next level that we're already trained to do, have been trained to do for years, and let's get up to that level now. So I understand why somebody might say, well, that's a long list, but keeping in mind that some of that is just to get up to par, basically. So let's talk about, we've already touched on it right now, but to ask the question kind of outright, why is scope expansion so important? Like, why is it top of mind for so many provinces right now? Who wants to go? I'll let Sophia, I'll let you go first on this.
Yeah, I remember actually when I first joined the board, and it was actually maybe second or third strategic planning, and I sat there just, second year out of school, just listening into what the environmental scan was, and everything was pointing to the progress of technology, the progress of research, progress of medicine, and the fact that people are getting older. We've heard this numerous times, right? That conversation isn't going to change for a while, and so when you start looking at essentially what is coming for us, what we see in our chairs, and as research helps us to know and identify more diseases, it's not that people are necessarily getting sicker and sicker. We're just learning more, right? And so with that comes the ability for, do we believe optometry should continue to grow? Do we believe that our profession, our day-to-day, do we believe that we actually owe it to our patients to keep up with the technology, with the service, with the medical advancements, and with our understanding of a condition, right? How crazy would it be to think about glaucoma management now without ever touching an OCT? That we think that an OCT is, too much of an advancement, or it's beyond kind of our day-to-day, that I'm going to maybe leave that one aside and see kind of what happens. And now we understand that there are things that we can do to help prevent, vision loss, all this stuff. And so it's kind of this paradigm shift of, it's not really that outrageous to think that we just want to keep up with what the best standard of care technology allows and all of that. So that's probably kind of more on the day-to-day side of things, the patient care side of things. But I think also, scope expansion is honestly, it's a way to help us to continue to maintain what we're interested in, right? Because, if you are not interested in doing your work and growing that, then, a bold statement, why are you here? Because if we're here to be doctors, to take care of our patients, but you're going to do it half-heartedly, you're going to do it knowing that there's something else that can be done efficiently, safely, evidence-based, then why wouldn't you do it, right? And I can understand maybe the concern of, well, maybe I'm not experienced enough, or maybe it's still new. And those are all fair questions, and those are all overcomable obstacles, if that kind of makes sense. But it's kind of the lifeline of healthcare and medicine and advancement, is that I wouldn't want to be a patient going in to see someone that's going to care for me, thinking that they haven't actually bothered to keep up with where things are going, and on top of that, while everybody else around them in their profession is actually keeping up, they've decided not to. I would want the best care for myself. I would want the best care for my family. And so when I think of it that way, kind of flipping it, I would hope that other professions are getting scope expansion to their ability and competency, right?
Absolutely.
Yeah.
I think that's actually a valid point if we look at it from the patient perspective. Sorry, Shine, I'll give you a second to speak on that in just a moment. But just that what you just said, like how many times I can just tell you, I can't even count, but like how many times I've had patients come in and say, "Wow, you've really bought new equipment. I appreciate that you're updating, you're on top of it. I can tell that you're staying on top of things. Oh, I've been to other places before that perhaps were not and looked old, and that might just be a perception thing from the patient, but also I think that's we know that we're providing better service and better care to our patients, again to the level of our training. I think is really important. So Shaina, if you don't mind, like why do anything to add to the question of why is scope expansion important?
Yeah, I'll just add two quick points. And one is in Ontario, we really are having like an access to care issue for a lot of our patients. It is getting harder and harder to have them seen by an ophthalmologist for things like a chalasia removal. It isn't reasonable to me as an optometrist to have my 3-year-old pediatric patient wait 18 months to get their chalasia drained. Like it just doesn't make sense to me. And so, like you were saying, Sophia, like we want our patients to be able to access the best care possible. And since we are the ones who can provide that to them, a lot of our scope expansion focuses around just that access to care for patients. I practice part-time on an Indigenous reserve that's like a fly-in only community in Northern Ontario. And I have to refer out for anything that is not within my scope. And so it seems a little silly to refer out for a foreign body removal that I think I would easily be able to do in my chair, to refer out for an LPI that I would easily be able to do in my chair, and to refer out for a skin tag removal that I also think I would easily be able to do in my chair, right? So so that's a big point for me, is just the access for patients. Especially in rural Ontario. I'm sure it's similar in other rural parts of the country as well. And then the second point is more and more we see optometrists diving into their special interests. And so it allows for there to be a pathway for referrals between optometrists. So for example, in Toronto where I practice, I have a primarily pediatric practice. I do a lot of BV work, a lot of VT work, a lot of concussion work, but I don't do a ton of glaucoma management. And so I would like to be able to refer to an optometrist who would like Sophia, who has done a number of SLTs, who would be, the best possible practitioner for one of my patients. And so even though this scope expansion request of being able to do lasers might not be something that I do in my chair every single day because I have a primarily pediatric practice, there is still so much value in optometrists having the option to provide those services. And there's still so much value in getting educated to be able to do those procedures so that you can make educated referrals if you don't choose to practice some of these scope expansion pieces that we're talking about.
Yeah, amazing. So much amazing information there and thoughts there. If I can sort of echo a couple of them. First of all, the access to care, I think, is probably going to be one of the top things that reasons for advocating for scope expansion. There's so many people who live in areas that just can't get access to care. They got to drive 3-4 hours to get an ophthalmologist or whatever it might be. If the optometrist there could provide care and then provide the services along the lines of what we've listed here, it would save a lot of patients a lot of hassle and a lot of trouble, right? And I think that's just, again, we are or would be fully competent and trained to do all of these procedures. It's not like somebody would say, now you have scope, okay, now figure it out. Like we would have to get properly trained and certified and then be able to serve these patients, especially in these more rural locations, as you mentioned, Shaina. Certainly is going to be very important. But the other thing that I like the point about referrals to ODs, and I make this point quite a bit on the podcast, that for the overall profession to thrive in the future and to be strong, I think it's very important that we do refer to one another as much as possible. Just given our existing scope, for example, let's say I'm seeing a patient, perhaps I don't do dry eye therapy in my office. I want to refer to another optometrist that I trust and know has the advanced treatment options or myopia management or VT or whatever it might be. But those inter-profession referrals are really powerful in a lot of ways. One, it gives a patient the reassurance that their optometrist knows what they're doing and they refer them to the right person. But it also gives them the the perception that our profession overall knows what it's doing and keeps us strong. And it fills in a lot of gaps. This is something that I really feel is true, that if we don't continue to fill these gaps of like with these referrals, that leaves space for other entities to come in and kind of carve their space within our profession and kind of start to direct the way the profession goes. So having those inner profession referrals is really powerful. And on the other side of things, if I could just add my little thought on like my little opinion on the importance of scope expansion, it might be it's maybe not the conversation we'll take to the government, but like we're just talking to ourselves as optometrists. Why is it important to continue expanding? Because if we don't, it's the other option is it's not just to stay stagnant. To your point, Sophia, earlier, I think actually if we don't continue to push for expansion, we start to contract, because there's always going to be forces from different directions trying to take part of our territory or our scope. And constantly, whether it's opticians or somebody else and it's not a negative. I'm not saying that in a negative way. Opticians should, like you said, continue to try to, continue to grow their profession and be strong if they're advocating for themselves and so. So we need to continue to do that in other directions, because if we lose refraction, which we have in BC, or if refraction goes online, which it will or has already in a lot of places, we're going to lose those pieces of our profession or our scope. And if we don't continue to grow in other directions, it's going to become narrower and narrower. And ultimately, there won't be a whole lot left for us. So that's my opinion on why scope expansion is so important, or at least it's one of the reasons why, in addition to what you guys have outlined as well. Any thoughts on that? That's one of the rants I warned you that I'd probably go off on. So any thoughts on that?
It's not a rant. It's just passion. That's
yeah. It's passion. It sure is. I try to keep my passion like contained a little. All right, let's. If there's anything you want to add to the importance, why it's important to expand scope, please let me know. Otherwise, we can hop on to the next question. Good. Okay. And I think, Shaina, you already outlined. The next thing I was going to ask, or I had written down, was what are we asking for? You've already outlined in Ontario what we're asking for. Sophia, is there anything that you want to mention on that point, or are we?
Yeah, so our scope request is kind of almost similar to the last bucket that Shaina had talked about. Right now, before government, we have requested, and I say we as in the Alberta College of Optometry, because kind of in our area, the regulatory body is the one that proposes the scope and writes the standards of practice, and then the Alberta Association of Optometrists support that, and we work quite collectively together. But what's before government right now is the request for the laser procedures, the capsulotomy, SLT, LPI, as well as lid lesion removals and injections as well. Since 2015 rather, we actually were able to get independent glaucoma management, lab testing as well, oral medications, Schedule 1, Schedule 2. And so that's been quite nice to have, and I feel for Shaina when she's talking about that list. Cornea, foreign body removals have been part of the scope, of Alberta since 1996. And this is not in any way to say, rah, Alberta, but it's more to say this is truly, again, we all get the training to be able to do all the stuff and be able to serve the patients. But so that's kind of what's currently on the table for Alberta. It's been about kind of 4 years in sitting and still looking at that and hoping for the ability to do that for the province.
I think we all kind of look to Alberta as sort of the golden child in that sense, right? Sort of leading the charge and having the broadest scope in Canada. And so we are all doing rah-rah Alberta too, because if it comes for Alberta, then eventually we expect the trickle down effect and set that precedent for the rest of the provinces. BC is not that far ahead of Ontario. I don't even know if we are ahead of Ontario, to be honest with you, because there's a few things that you've mentioned, Shaina, that we're asking for too. Now, I'm not going to go into that because that's not my place. We're going to have the next conversation on the podcast, next episode, with Dr. Evelyn Lo, who's going to talk to us about that, what BC is asking for. But let's stick to our wonderful guest that we have here today. And Sophia, since I got you kind of on the spotlight right now, and you're talking about the things that Alberta is asking for, these are things that, as we said right off the top, you have done many, many times already in your career. So I'd love for you to tell us, what is what are the benefits, of having the scope expansion? How has it been beneficial for you or other people who have been practicing to that level of scope?
Yeah. I mean, patient first, right? I think in the private practice that I was at in Oklahoma, it was a high volume surgical practice. And so a lot of our referrals were actually optometry to optometry. They knew that the optometrist triaged a lot of it. The ophthalmologists were able to stay in surgery. That means that wait list for cataract surgery is 2 weeks. Imagine that, right? Right now I work alongside ophthalmology, and our wait list, even though, our surgeon is excellent, really great surgeon in the Calgary area, wait list is still about 6 to 8 months right now. And that's not because necessarily that he's also a cornea specialist, right? But anyways, that's besides the point. But the idea behind it is that it frees up the surgeon's time to stay in surgery to do all of those different things. The cataract surgeon that I worked alongside during the residency was an oculoplastic surgeon, general cataract surgeon. We also had glaucoma surgeons, and it was very similar, whether it was those different areas or not. Glaucoma, the surgeon that I worked alongside, trusted me to be able to do the SLT, to make the call, and to help even triage some of the decision making across, going towards the advanced glaucoma surgery side. But I think what really also kind of brought it to a bit more of a level where it all clicked together was that optometrists are actually doing the decision making and diagnosis already, right? And so when I moved down to the States, I worked in private practice for about 5 years after school, and then went down to do my residency and fellowship after. And my thought, my concern at first was that the procedure itself would be the most challenging, and kind of thinking, okay, you know what, I'm going to go down and kind of do, press the button and make the incision and all of that. But really, what the sort of mind shift kind of was really, I was on the one side of the referral letter, and now I'm on the other side. And so I have to think a couple more steps now. But it was actually interesting because the procedures themselves actually were a lot easier than I imagined. Not to say that they're, anyone could do it. It's just that optometrists actually have the training. We have the understanding of how to work a slit lamp. We know how to focus everything. We know how to differentiate the cornea from the lens, from the optic nerve. That little bit of the axial length of 20-24 millimeters is huge when you have a slit lamp. So that wiggle room that we have, optometrists know where we are in the eye. And then, working with the lid tissue, we're looking at the eyelids every day. And so what really clicked and almost made it a lot, demystified was these procedures are not that far off than what we're currently already doing. The diagnosis, the preoperative care, the peri and postoperative care in some cases, depending on, especially if you're in rural, you're doing this every day. Literally the only difference is whether you are doing the injection yourself, pressing the button to fire the laser, knowing where to aim, all these things. But the postoperative care management, all of that is actually well within the day-to-day practice of optometry already. So that was one thing that would help me to understand the pathway. When we feel that there's this referral process that kind of takes place, I was able to see it in a more efficient way, and the patients didn't have to wait as long. They were able to get better continuity of care because they knew the faces that would be doing their procedures. And then truly, honestly, what really swayed me was really just seeing the fact that we had, everybody practicing to their highest level in an efficient manner, like to the access point that Shaina brought up. A person who had a, PCO after cataract surgery, couldn't see, couldn't drive, couldn't work, didn't have to wait another 4 months to be able to get the eye capsulotomy. They got it that same day with me, and then I managed them after, right? And what I really enjoyed there, because it'd been so long in Oklahoma, the standard of care is that, right? The minimum standard, this is considered normal. There isn't a discussion on scope expansion in that way in Oklahoma, because that's just their scope. And what I really enjoyed was the collaborative nature between optometry and ophthalmology in that setting, where it was just accepted, right? So I get the tension that happens before it passes, but I saw also just how much it worked, and how much patients were able to benefit from it. The doctors were able to benefit from it because ophthalmologists were able to, focus on the areas they wanted to, their special interests, without being slammed. Optometrists took call. And so, if you have an angle closure that's happening, you can manage it because the theory, basically, what's happening, how to diagnose it. And then now you have an ability to treat it. You have an ability to save vision, right? So these kinds of things were things I got to see on a constant basis. And it became normal to me, it became normal to kind of think that is actually what a certain level of co-management and collaboration can look like. And to be honest, it's not even just like optometrists are the only ones that see it. ophthalmologists do as well. In the jurisdictions where this is happening, ophthalmologists do actually see it. There are clinics that are co-owned by optometry and ophthalmology. There are clinics that have both underemployment, and it works.
Mm-hmm. I think that actually the last thing you just said is maybe the most important thing. It works. There's proof
Yeah.
that it works, right? There's examples of it, not just Oklahoma, but other places where that collaborative care can happen and it works. And the people are not losing their vision and buildings are not being set on fire, and you know what I mean. It just works.
Yeah.
Shaina, anything you wanted to add to that?
I mean, I think Sophia gave a pretty comprehensive answer, but I will just say one of the brilliant things that you mentioned was that we are already, well aware of what the patient needs when we are sending referrals for SLTs, for YEGs. So for those practitioners that might be a little bit apprehensive about the scope expansion, really, you've already made the diagnosis. You've already done the hard part, like you were saying. The rest is a technical skill that we all know we are able to learn and do. So really, to me, the challenging part is, like you mentioned, not the physical skill, because we can all learn to do that. You're already doing the difficult part of diagnosing. Because I know, in Ontario, optometrists really are, the gatekeepers to ophthalmology. It's very rare for patients to be able to go direct to ophthalmology. So you are already sending that referral. You already know what the patient needs. It just seems like a no-brainer for you to be able to provide that care yourself. And so I know that's a little different tangent, but it was just nice to hear Sophia say it. It really is just a brilliant point.
No, it's lovely to hear from somebody who actually has been practicing to that level, or has the experience practicing to that level of scope, and seen it firsthand, seen the relationship with ophthalmology, and seen it work, most importantly, in that setting. So you can tell us firsthand that this is something that does work, right? Otherwise, I think the skeptic part of, we're going to maybe just move into the next question here. Part of the skepticism and the pushback might be, well, we don't know, like, what happens? What if this happens? What if that happens? But there are examples of this working, and not just recent examples, right? Oklahoma's had this for a very long time now, and it's been working. So we have that precedent that we can look at and learn from, as far as, how well it will work. But given that skepticism, pushback, resistance, these are things that I want to kind of touch on now. Where is the resistance coming from? And there's probably resistance from a few different directions. Maybe we can touch on, the few different areas that resistance is coming from, and how we can perhaps overcome that resistance and sort of help everybody see things in the same way. Anybody want to go first?
I'm happy to start, because we just did a consultation period, which is essentially allowing anybody to provide input on our scope expansion requests. And I should say we, as in the college, actually did that. Sophia, similarly to yourself, the college is very involved in our scope expansion. It was a combined effort between the association, the college, and the university to push our scope forward. But as part of this process, the college had to do a 60-day consultation period where they sent our scope proposal to a number of stakeholders, and anybody could provide, responses, concerns, support for the scope. And we did receive a letter from the OMA just outlining their concerns for every single point that we were asking for, including some of the things that optometrists are already doing across the country, like foreign body removal below the epidural.
Sorry, Shaina. So they provided resistance to every single point?
Every single one, yes.
And was that the point of that exercise, was for them to provide, or they could if they needed to or wanted to? There's potentially they didn't need to provide that.
Oh, no, they definitely didn't need to. You could have a consultation period where nobody has any issues, and it was not a requirement of them. That was something that they chose to do. And to be honest, it's not surprising to us. Ophthalmology has been our primary, point of concern or contention for us every time we do try and do scope expansion. Back when we requested TPAs in 2011, we did receive that pushback as well. Their concern about optometrists not having the education or the understanding, because we haven't done the 4 years of medical school and all of the things that they have done. And so I think that's a great example that, we are very well versed and very capable of prescribing TPAs. No one has, the sky hasn't fallen. But just to circle back to where we are right now, they did provide this letter to the college outlining their concern with each of our points. And after reading it, I realized that I think there's just a huge misunderstanding in the medical community of what optometrists are trained and capable of doing and what our true role in the healthcare system should be. And I'll give you an example. One of their pushbacks was on optometrists being able to do ultrasound and perform an A scan. And in their response back to us, they said that they were unsure of why optometrists would even want to be able to do this, since the primary purpose of an A scan is to figure out axial length, which is a pre-operative procedure. And so that to me just speaks to the misunderstanding of what optometrists do, because if they didn't flag the fact that we would use it for myopia control, which is a huge part of a lot of people's practices, then either, they are remaining willfully ignorant of what optometrists are capable of, or, we need to bridge that gap and better educate the Ontario physicians so that they can be more supportive of our scope. So that is one. And the other portion of their letter, or another portion of their letter, I should say, spoke to the fact that there's no evidence that patients aren't receiving care in a timely manner. When we talked about access to care issues. And so that's another one where perhaps they're a little bit less aware of what's happening, like boots on the ground, before patients see them in their offices. Because we did conduct some research. We called actually every single ophthalmology office in Ontario to see if we could get a patient seen for chalasia removal. And so more than half of the offices did not pick up our phone call. We couldn't get a hold of them after 3 attempts. And for those that were able to answer the phone or get back to us for our referral, less than 20% of them were able to do the chalasia removal within 3 months. And so that equated to, if you're looking for an ophthalmologist, about 7% of them would be able to do a chalasia removal within 3 months. And that seems like an access to care issue to me. So I think there's just a big misunderstanding about what optometrists are truly capable of doing. And so the association is looking forward to the opportunity to educate the OMA on optometry's role and what it really should be as part of the healthcare team in Ontario.
Yeah, that's excellent. Excellent. Thanks for providing that information. Sophia, on anything from your side as far as resistance and opposition to scope expansion?
Yeah, I mean, on kind of on a clinical, stance, I guess, day to day, boots on the ground, there actually may not be as much outward opposition as kind of vocally there is kind of politically. But, like Shaina said, there are these opportunities presented in stakeholder consultations. And most of the time, there's going to be this kind of disagreement for the access issue, the safety issue, the education issue, the competence issue. This has been brought up at almost every scope expansion with, at every level. So this is not just on the lasers and chalazion removal. It has been brought up on TPAs as well. When optometrists first wanted to be able to have the ability to use fluorescein dye to be able to stain the cornea, God forbid, that was a big point of concern as well. And so I think optometry has been able to prove time and time again that the education is there. And I think, when you look at the different professions that have expanded their services, and I say that in a way that not every single profession has to go back and request for a scope expansion to be able to do more. We look at our dental colleagues, dentists, nurses to some extent, and, pharmacists as well, too, to some extent. These professions do not have to go back and do a medical degree to be able to go and expand their scope, right? And neither do medicine, neither does ophthalmology need to go back and redo medical school to learn how to do LASIK, right? And so these kind of things are important to understand about these transferable skills and whatnot. But when it's a kind of a higher sort of political discussion about it, oftentimes kind of the arguments are not new. The concerns brought up are not new. In fact, they haven't evolved as the medicine, technology, as things have evolved, but professions have actually evolved. The arguments have not, and so you can interpret that whichever way you wish. But that is a known and well understood, I guess, opposition, and that's one side. But I think sometimes optometrists don't believe in ourselves. Optometry has kind of developed maybe a little bit of an inferiority complex. And I remember, coming out of school being terrified to pick up on call, thinking that, oh no, this is going to be, I'm going to get schooled in this conversation. But no, I saw the patient, I applied my learning. I knew exactly what they had. And I called to say, hey, I think this needs to be seen, right? And so there's this sort of, I don't know what it is, and I've always kind of had trouble putting my finger on it, but there is a jacket that we wear sometimes that, and for people who may not be as ready to step into, pushing for something like scope expansion. Sometimes there is this jacket of concern or self-doubt that we wear that sometimes gets in our own way, right? But, I challenge anyone to think about, if you like what you do, if you are in optometry, you like what you do, if you think about your most favorite aspect of your career and your position, your special interest, whatever it is, even being a business owner, all of that was achieved on the shoulders of somebody who actually trailblazed before you, right? None of this is there because it just so happened to land in our laps. Nothing ever landed in our laps, right? And so I kind of think that a big barrier is actually within ourselves. I think we fight ourselves, and there's a little bit of this, idea that, maybe we don't need to keep asking for more. Maybe we have enough. And that's a very dangerous way to think about it, because, what's considered normal now wasn't normal before. And so I think that's another part that, I think, everyone who is in this process, whether you're all for it or whether you are really hesitant, I think it's kind to understand that we all see it from different angles. And hopefully we'll be able to get close to this kind of the same page to see that at least if you aren't going to be doing a laser procedure, then at least, you want to be able to at least help someone be able to do it. So for example, I work in a surgical practice and I do mostly medical cornea, anterior seg disease, advanced glaucoma management. But if I have someone that, I see who's had a concussion and, obviously is showing post-traumatic brain injury, vision disorders, or, we've got someone who is a high myope in my chair, talking about refractive surgery, and they've got a child sitting there with them. I'm not going to be opposed to scope expansion for myopia management and vision therapy because it's not my wheelhouse, right? We actually owe it to all of our patients and all of their families to understand that optometry actually is very comprehensive in what we can do, and that scope expansion exists actually across many special interests we mentioned before. But to not step in the way. I wouldn't step in the way of somebody being able to do more in vision therapy because I'm not going to be doing that in 5 years, right? It wouldn't be fair. It wouldn't be arguably ethical, actually, to be able to try to prevent a patient from getting care from somebody who is actually going to be trained to do it. So my 2 cents on that, I think that, sometimes we are our own worst enemy. And that can be actually sometimes more of a detriment to scope expansion efforts than political opposition, actually.
That's very eloquently put. I appreciate that, Sophia. Thank you. That jacket of insecurity, or however you phrase it, that's really a wonderful expression. And I think you're absolutely right. I think as optometrists in general, not everybody, of course, but in as a profession, I think we sometimes do have a bit of that inferiority complex, and I think we need to all kind of bond together and have a bit more confidence that we're making, a huge impact in our patients' lives, and we can continue to do so. Big part of that is expanding our scope. And, going back to something you said, I, to be very, very, very transparent, this is my podcast, and this is me saying this, not you guys, but I've heard and I've seen some of our colleagues kind of opposing the idea of scope expansion, and it bothered me, right? I was just like, why would you not? I just don't understand where you're coming from. And then, in the moment, that was my feeling. And over time, though, thinking about it and trying to wrap my head around it, I understand, try to your point, Sophia, trying to come with, compassion, empathy, however, just trying to view this, try to understand, be in somebody else's shoes. I don't know exactly what they're thinking because I haven't specifically spoken to our colleagues who have those the hesitancies and the resistance, but trying to understand it. I can understand why some people may feel a little, going back to what you said earlier, a little fearful or hesitant or unsure. What does that mean for me and my practice and my patients? Again, maybe perhaps that feeling, maybe they don't understand it, or can't put it into words themselves, perhaps feeling that inferiority compared to ophthalmology or whatever it might be. But definitely coming to this now with more empathy, and would love for my colleagues to understand the benefit, just the same way you put it, Sophia, that the benefit for the whole profession and other colleagues who really do have that fondness and that enthusiasm to practice at that level. Doesn't mean that I have to do lasers in my practice, but certainly I don't want to stand in the way of you or anybody else doing it, and knowing that ultimately it's going to be for the greater good of the profession. I'm a big fan of Stoic philosophy, and I'm always posting things and saying things about it. But one of my favorite kind of ideas from Stoic philosophy is sort of what is good for, there's a Marcus Aurelius, who is one of the famous Stoic philosophers and Roman emperor of course, thousands of years ago, said, and it's been quoted many times from him, that what's good for the hive is good for the bee. And so what's good for the profession is good for us, all of us. Even if I'm not going to do lasers, somehow it's going to benefit me if I can help my whole profession to continue to grow and thrive. Eventually, somehow it's going to benefit me. And so I just want to encourage any of our colleagues who out there might have some resistance. I think it's important that they voice it, so we can have the conversation about it. Don't hold it inside. Make sure you do voice it. And if somebody, speaking to the colleague who does have that hesitation and that resistance, if somebody shouts you down, don't let them shout you down either, right? Have a conversation. Let's have a proper conversation about it so we can all understand I'd like to understand where they're coming from, so we can make sure we can help them feel more comfortable as we continue to make this push for scope.
Mm-hmm. And that's huge. One of my favorite parts of having a laser lab or a workshop across the States and Canada is in the last maybe 20 minutes, I do kind of this like closed door family chat. And any question is fair game. And those are some of the most honest conversations I've heard from colleagues who are actually, some of them are in the room with some of the people pushing for scope, and they're thinking, I don't know if we should be doing this, and these questions, and these are important conversations, like you said, Harbier, and this whole podcast series is so important to have, because if we decide that we're going to plant our feet and stand on the side that we are on without hearing the other side, and vice versa, this could be from someone who is all for it and unwilling to hear the opinions and thoughts and concerns of someone who's not for it, then what you're actually creating is division. What you're creating for yourself is basically what the political ophthalmology has done to optometry, and you're actually doing the exact same thing, right? And so, in a time where we have enough forces pushing in to try to carve into our territory, or to oppose the expansion and whatever it is, right? All these things, there's actually no room and no space and no time to be divisive, actually. And so it is, like you said, to challenge anybody, whether it's the leaders in the provinces listening, where listen to the people who are the naysayers, because they actually have a very important voice and a very valid concern that they're probably not the only ones. They may be just the only ones saying it, but these concerns, guarantee that some of the thoughts and hesitancy, the unfamiliarity, you're not the first person to have them. And some of us would have probably had it even before we stepped into these roles. I certainly was terrified to do my first laser removal, thinking, oh boy, here we go. But you kind of start to see it from people who have walked through that hesitancy and come on the other side and can tell you it's going to be okay, right? So it's very important. These discussions are very key, and it's important for us to hear each other before we say, nope, they don't get it, and write them off either side, right?
Yep.
So
100%. Wonderful. Thank you, guys. This has been an amazing conversation. I think I hope anybody who's listening or watching is taking away a lot of information as to why scope expansion is important, how it can be beneficial to our profession, and how we can talk about it a little bit more. Any final messages? Actually, I'll open it to both of you. Please share any final messages that you'd like to. I'll let Shaina go first. Any final messages you want to share on the idea of scope expansion?
I'm just cautiously optimistic in Ontario that we're finally at a point where we're at the table. This government seems to understand us better than any of the governments in the past. They really do seem interested in improving access to care in Ontario, and recognizing that optometry is one of the ways to do that. And so I hope this ages well, but I am just really optimistic that we'll be able to move the needle on some of these points. And, maybe Ontario will be the next province that people are looking at to be able to say, rah, rah, Ontario. And we might actually be the trailblazers instead of just trying to catch up like we are for some of these things. So that's just the point that I wanted to leave, optometrists and Ontarian optometrists specifically with, to say that it's an exciting time to be an optometrist in Canada, in Ontario as well.
Absolutely. Love that. Rah, rah, Ontario, for sure. That's Sophia.
Yeah, I think that the excitement is there, and there's been a momentum, right? You had said, you made a point, Harbier, that we're not looking at just Oklahoma being kind of somewhere that this has been normal. Since 2020, since we actually submitted our scope request, there's been 5 other states and 20 other jurisdictions that have gotten lid lesion and lasers. And so there's a wave here. And the fact that this podcast is happening, this podcast series, is because there are actually now multiple provinces approaching, or as my understanding is that sometimes the government is approaching the provincial associations actually, to say, hey, we recognize that there's need for change to happen. And so there is a movement here. There is a momentum, because I think that if you kind of sit back and look at it, it makes sense. And so my encouragement is, if you have already done these procedures 1,000 times, go in and continue to chat with people so they can hear your experience. If you are not really sure and you're hesitant, reach out and ask questions, right? And let's have a conversation about this even offline as well, because it is the strength of Optometry Collective together that is going to move this. It cannot be just the few that the 3 or 4 or 5 at the leadership roles that push it. It has to truly be a collective. Everybody, as much support as there can be, as we would hope that if anybody has their own special interests, and right now that's not the focus of scope expansion, that we would hope that come time for when that needs to be on the platform, that we would also get the support of the optometrists around you as well. So
absolutely. Wonderful. Thank you both. Thank you so much. What a great conversation. Honestly, very enlightening for me. Even just speaking to you both, I'm learning, I'm getting energized, I'm getting enthusiastic about the idea of scope expansion and the importance of it. So thanks again for taking the time, both of you, Dr. Sophia Leung, President of the AAO, and Dr. Shaina Nensi, President of the OAO. And please, everybody who's listening and watching, please do tell your friends. As I said, let our colleagues know we're having these conversations. This is really, truly for the benefit of our profession, the growth, long-term growth and success of our profession. And as I mentioned in the beginning, this was part 1. We're going to have a second part, so make sure you look out for that. That's going to be with Dr. Evelyn Lo, BCDO President, and Dr. Sarah MacIver from the University of Waterloo, to talk about, from their perspective, the importance of scope expansion, and Dr. MacIver's experience as a subject matter expert as well. So stay tuned for that. As always, thank you so much for tuning in to the 2020 podcast, Canada's #1 optometry podcast. We'll see you guys in the next episode.